changes. And as you're describing all these interacting things, it's not a matter of the Weight Watchers is good, surgery's bad, surgery's good, Weight Watchers bad. That's not the issue. These are complex systems that we're still learning about. And it's important to, we need to do things now to reverse acute problems. We need to avoid throwing solutions before we understand all the questions. We need to be asking the questions and say, how do these factors interrelate and where can we intervene? And so surgery is going to be one intervention, behavioral change is another, redesigning how we live our lives, how we build our cities is another. And I think as that picture gets richer, we're going to be able to be more effective in making the changes. But just like it takes a commitment to change our behavior in terms of diet and exercise, it's going to take a change in commitment as citizens, how we design our society and our environment to help protect, future generations, young kids now, and to make it easier to make some of these reversals. So I wanted to bring that up partly because this whole event is also to help share with you how we think about this, how we apply that kind of system analysis to these medical problems, to individual problems. And encourage you to, like Walt was saying, you need to get involved. Well, it's important to get involved, both for your own health and for your community.
And it's not as hard to get involved as you would think. A letter a year is worth doing. I think a lot of times people feel like, if you're not on that committee, or you're not showing up once a week to this and that, but just even being lightly involved makes a difference. So, thank you so much.
So, Christopher, do we have any evaluations? New?
Oh, I don't.
I'll be right back.
Oh.
Just please let me
Yeah, I would love any suggestions for, it's probably would have went out before. Any suggestions for what you would have liked to have seen? I try to put decent stuff on my blog, for links to things. So, and I'll be up here for a little while if anybody wants to have individual questions. So, any other group questions?
One quick question.
Yeah.
Could we use those cards that Pete does come back with evaluation?
Yeah.
What I'd like, if you wouldn't mind, there's some large index cards up there. If you have any feedback into what works well, what you'd like to see in terms of topics, speakers on this series, we really read all the feedback. We want to make this as helpful as possible. So please leave us your feedback. If you have to take off, give a call to the Medical Society office. It's Whatcom County Medical Society. I think on the flyers there's the phone number. Christopher, do you have the evaluation forms? No. Okay. So index cards or phone numbers or email. Thank you.
Thank you. It's a whole 10 to 15, 20-minute talk. But in terms of after effects of surgery, any surgery has risk, benefits, and alternatives. So you can have scar tissue infection. The risks of surgery are there in the short term. The long-term risks with weight loss surgery, in particular, are some of those malabsorptions I was talking about. A few people will need additional supplements, or they'll have anemia. Bowel obstruction from adhesions, scar tissue that can happen after any abdominal surgery is a little more common after, especially gastric bypass, because the small bowel is what tends to get a little tangled. We can usually take care of it overnight. We usually go and throw it into ports and just cut the adhesions and send people home the next day. But any complication can kill you. A nosebleed can kill you.
Is there a risk of overeating afterwards and tearing something?
Very little. I have never seen anybody tear their pouch. People talk about stretching their pouch, but usually it's just things heal and you get able to eat a little bit. It doesn't stretch much more than your ears do as you age, and it doesn't become 10 times bigger. I've never seen anybody actually tear. You can get things caught sometimes, but that's pretty rare. You can get ulcers where things are hooked up. What else particularly? The list goes on. Thinking both short and long term. Throwing up, you can still throw up with most of these. The lap band in particular, it's harder to once things are down below it. But yeah, you can throw up. How was it? It was so clever. Oh, Marlene's section I got to talk transfer of addictions. is something that the psychologists worry about a lot. You see on Oprah, Carney Wilson has done very well, but has struggled with alcoholism both before gastric bypass and after gastric bypass. She has been an alcoholic her whole life, and gastric bypass did not take that away. And when you do take away, when you take away the comfort of food some, and I can still get comfort from food, but I can't go eat a whole pizza. So when you do take that away, some people will overdo other things. It tends to be more of an over-exuberance as I've seen than an actual crazy, horrible, life-ending problem. But we have to respect alcoholism. We have to respect depression. About 40% of people at a minimum are depressed even before weight loss surgery. Depression is probably one of the biggest killers in our society. And if it's there after surgery, suicide risk goes up a little bit in the years after surgery. Sometimes, I tell people at information sessions and one-on-one and in groups, it's like winning the lottery. Winning the lottery wrecks a few people's lives every year. They become millionaires and they lose their family and they lose their friends and they're dead 2 years later. And they won the lottery. Sometimes it's going to be that way. There's always good changes, but change, I didn't talk about this hardly at all. I'm not just a surgeon. I do care about this stuff too. So change can be a threat to a family unit. It can be a threat to a work unit. A lot of people, I've heard from more than a few women who were the heavy girl in their group. You know, they have a group of 4 or 5 friends from college, and as soon as they lost their weight, and the girl who's always a girl, they're in their 30s and 40s, but the lady who was the next heaviest lady in that group for 10 years is now the heavy one, friendships totally fall apart. They are so mad because now they're the heavy. And the people will come in and say, why? Why won't my friend talk to me? Nothing you did, you know, but you've got to respect those relationships. And that can be tough. Husbands can become jealous. Wives can become jealous too, but guys have a harder time adjusting, I think, sometimes. We get threatened, you know. I'll tell you, gosh, is that thing still recording? My wife lost both her parents to cancer. Well, guess what they did? They were a little heavy, they got skinny, and they died. She looks at me, she knows I'm not dying, but what does she feel? It's hard. That's been, I mean, not terribly hard, but unexpected. So there's a lot of stuff to deal with that way. Life does have to change, but I can still go out to Applebee's and have a salad and be a real person. I don't sit at home eating, you know, wafers of protein pack. You know what I mean? You can look your first 90 days after surgery, you are really on a recovery diet. Your yogurt, cottage cheese. It's, you know, if you go out, you're going to have this much of something because most stuff doesn't go down that well, and you got to chew it so much. It's a lot of liquids. But once things are healed, you eat like a size. Well, we used to say eat like a size 6 woman. They changed all the sizes. You basically eat what a size 2 or 3 or whatever woman eats. It's a reasonable amount of food, but it's not a nothing. And you go slow. I'm wicked slow. Eat. There's some other changes, separating fluids and solids. Again, this is an introduction, but there's a lot. There's a lot to talk about, a lot to get ready for.
One more question.
Just a quick question, because you said something about somebody talking to you about eating a half a cup of food, and then a year later they're eating 5 cups of food.
They're worried they're going to eat 5 cups of food.
Okay.
What happens is your first year, the weight really falls off with a lot of people. And that is sometimes where they can look a little over thin, they get a little, you know what I mean, kind of hollow. That's also where the skin looks the baggiest, you know, they get pale looking a little bit. But then at about 1.5 years, 2 years, you know, things stabilize and the skin sort of catches up and the muscle comes back a little bit, you know, the glow kind of comes back a little bit. But that first 3 months, you cannot eat more than about a half a cup of food. That's what we call the honeymoon, especially with gastric bypass. It's just falling off. You have no appetite. You have to remind yourself to eat. Some people we have to push to get enough protein in because you don't want to lose weight. So it's not a race, okay? That's one of the things people like. Sometimes with the band, you know, it's a slower weight loss. But at about 1 year, you can eat about a cup of food. I'm giving averages. 1.5 years, you can eat a cup and a half. And it tends to stay at about that rate for a meal, for a 30-minute meal. I'm more than 2 years out now. I'm a guy, pardon me. I can eat a 1/4 pounder with cheese over about 45 minutes. It's actually not a bad protein source as long as you don't have a large fry and a Coke with it. And you don't have, you know what I mean? It's what, 600 calories? But I can lose weight on, you're going to kill me, I'm going to run. I can lose weight on 3,000 calories a day. I'm sorry, I'm a
How
guy.
much do you exercise?
About an hour a day. But even without, I'm a guy, life is unfair. I'm a winner in the metabolic sweepstakes. It's a miracle I wasn't 500 pounds, if you saw the way I ate. But anyhow, so people, they see that ramp and they think, I'm going back to being able to eat 5 cups, and it doesn't usually happen. What can happen is you can nibble all day. If you have a friend who's lost their way with weight loss surgery, and they have a big bag of gummy bears on their desk all day, and they eat one every 10 minutes, that's kryptonite to weight loss surgery. You can defeat weight loss surgery. People don't intentionally do it. It's a bad habit. They're anxious, and as long as we inform them and keep them engaged, most people want to change that back. It's like, well, how can I get rid of the gummy bears? Can I have 5 gummy bears a day? I say, sure. You can have 30, but just have them as a part of a plan. Don't have invisible calories. So nibbling is really kryptonite. The other kryptonite is liquid calories or washing food down. If you drink, if I go to McDonald's, I haven't, or I don't do this. I'm very religious about this. But if I wash every bite down, I probably could double what I eat at a meal and cut my satisfaction in half. Why would I want to have less satisfaction? But people, they get uptight about not drinking or looking weird with their meal. I've learned to be nicer to the waitresses and let them bring the water, and I just ignore it, as opposed to, don't bring the water, they get upset. Waiters, there's all sorts of stuff to talk about. Waiters, you have to learn to say to the waiter, I love the food, because guess what's gone 6 minutes into a meal? You go to Outback Steakhouse, everybody finishes in 12 minutes. 12 minutes into a meal, I've eaten this much of it. They think I hate the food. Well, I do at Outback now, but you know what I mean. You have to. It's going to take you 30 minutes to eat a meal, so there's social things you have to learn, and your spouse is going to have to learn that now maybe your meals are going to take 20 or 30 minutes, and they got to sit there with you. And if you're at Red Robin, and they've got the free basket of fries, they used to, you know what I mean? They didn't have access to that basket of fries because you were eating them. You know, there's lots of adjustments. Changes happen within families.
Systems thinking.
It really is.
Well,
Did I answer your question? Yeah. The 5 cups, unless you really eat the 5 cups over 3 hours in a row, it's not going to happen.
I think we need to wrap it up, but thank you again. Next week, Ed Thompson and Bill Hall from St. Joseph's Cancer Center are going to be speaking about the art and science of cancer diagnosis and treatment. And the following week will be the last week